Hi, my name is Tom Hammond. I'm going to talk about safer sex in regards to avoiding contracting sexually transmitted diseases or infections. And we're calling it safer sex instead of safe sex to acknowledge the fact that outside of abstinence, there's really no perfect way to avoid STDs. There's always a little bit of a risk. Before we talk about safe sex and how to avoid STDs, first talk about risk factors, in other words, how to make it more likely to get sexually transmitted diseases. The first one would be having multiple sex partners. It stands to reason that the more people you are exposing yourself to, the more people you're having sex with, with each extra partner, there is an extra chance that you'll be exposed to an infection. The next one up is not using protection, such as condoms. Condoms provide a great protection against sexually transmitted diseases, and not using them leaves you very much exposed. If you have a previous history of sexually transmitted diseases, then that can increase the likelihood that you become infected when you're exposed to another pathogen. Drug and alcohol use, the way that that contributes to it is that it affects your judgment and skills. So if you are inebriated, if you've been using drugs, then you are more likely to make a poor decision without thinking first. Also, being an adolescent female, the cells in the cervix in teenage girls are rapidly changing, and that actually makes them more susceptible to sexually transmitted infections. So one way to reduce your chance of contracting an infection is mutual monogamy. Instead of having multiple sex partners, if you have one partner and you and your partner are both faithful to each other and do not have STDs, then that obviously reduces your exposure. And obviously this works best if both partners get tested beforehand so that you know that you're both clean, and also your partner needs to be someone that you can trust, because if they're sleeping around, then again, you're going to be exposed to sexually transmitted infections. It's important always to think before you act. If you're in a situation where you might be exposed, where you might make a decision that puts yourself at risk, you might want to stop and think about it. Is what you're about to do worth the risk that you're taking? What else could you do instead to have a good time? Do you have protection on you? It's something you want to think about and plan ahead. And again, you want to avoid using drugs and alcohol to the extent that you inhibit your decision making and end up making poor choices. Now, the only way that you can be absolutely certain that you don't expose yourself to sexually transmitted diseases is abstinence. That obviously means not having sex at all. Uh, Important thing to note here is that there are alternatives. If you want to spend time with a member of the opposite sex or someone that you love, there is cuddling, there is hugging, fondling, anything that does not put your put yourself in a situation where you're sharing bodily fluids, then you can enjoy those activities without worrying about getting infected. Um, Kissing, on the other hand, that can go either way. It's usually safe, but with some situations, such as an oral herpes infection, there is a possibility that you could get an STD from that. And then, of course, there are other possibilities. Go out on dates, watch movies, go play pool, play video games together. There are lots of things that people can do to enjoy each other's company that don't put you at risk of sexually transmitted diseases. And if you are going to have sex, the most important thing you can do for yourself is using protection. Condoms are the way to go here. Obviously, there are other contraceptive methods that reduce the chance of pregnancy, but condoms are what you need to use if you want to reduce the chance of getting a sexually transmitted disease. It's important to understand that condoms reduce the chance of becoming infected, but they do not prevent it entirely. There are some sexually transmitted diseases that you can get even when you're wearing a condom. It's important to use the condoms properly. If you don't use it properly, which we're going to talk about in more detail later, then you're putting yourself at risk still. And it's also important not only for vaginal intercourse, but also anal intercourse, and also even oral sex, since things such as herpes can be transmitted orally. You want to use the condoms there too, and there's also dental dams available for oral sex on females. And for the ladies, there are female condoms if you can't be sure that the guy you're with always has a condom on him. So if you carry female condoms yourself, then you're always covered. As far as condom choices go, most common substance used is latex, and those provide good protection. Alternative to latex are polyurethane condoms and polyisoprene, which can be used for someone who's latex sensitive. There's also lambskin condoms available, but it's very important to note that there are tiny holes in lambskin condoms that sexually transmitted infections, the pathogens that cause them, can pass through those. Lambskin condoms work just as well for preventing pregnancy, but are not appropriate for preventing sexually transmitted diseases. It's important with condoms, you can use water or silicone-based lubricants, but you do not want to use oil-based lubricants because they can actually cause the, especially latex material, to start to decompose. Alright, let's talk about how to properly use a condom. The first most important thing is to have them available to begin with. You want to make sure, if you're sexually active, you want to make sure you always have condoms at home, and if you're going out in situations where you might have sex, you want to make sure you always have some with you. You also want to make sure that any condoms you have are not past their expiration date. Always check their expiration date. If it's past the expiration date, you need to throw them out and replace them because they're no longer going to be effective. When it comes time, you want to make sure before you open and use the condom that you have a full erection. You don't want to put a condom on a non-erect penis because it's not going to fit properly, and you're going to put yourself at risk of it coming off during use. When it's time to use it, you take a look at the package. There are straight edges, and then there are also edges that are kind of easy tear edges. You want to make sure you tear by the easy tear edge. You don't want to use your teeth. You don't want to use anything sharp to open a package, because especially in the moment, if you're in a hurry, there's a very high likelihood that you're going to break or tear the condom if you use something sharp. So you want to use the easy tear edges. Open it up. Pull it out. After you pull it out, the important thing is to make sure you know which side is which. So oftentimes just looking at it, especially if it's dark, you might have some trouble. So you need to feel the roll and see which way it rolls. So I can feel this one not rolling up, but it's rolling down. So you want to make sure the tip is pointing up, and you can roll it down. Now you have your erect penis, like this one. Put the condom on the top. It's very important that you leave a little space with the reservoir up top for it to catch the semen, and you pinch it a bit before you start rolling it down, because otherwise there's going to be some air trapped in there, and that's going to block things and increase the chance that the condom breaks. So you pinch the reservoir and you start pulling it down. You unroll it all the way, and there you have your condom that's on. After ejaculation, it's very important that you pull out right away while the penis is still erect. Otherwise, if you let it go soft, then the condom could very easily fall off, and you're increasing the risk of both pregnancy and sexually transmitted diseases being passed along. So when it's time to come off, right after ejaculation, you want to hold the penis at the base, pull it out, and then you want to hold the condom when you pull it out so the condom doesn't come off. And then you take it off and dispose of it in whatever way you find most appropriate. Alright everyone, I hope you've enjoyed Christine, Molly's, and my presentation. You can go ahead and take a look at this quiz yourself over the material that we've covered. Go ahead and write down your answers or think them in your head. Maybe pause the video right here, because in a few moments we're going to go forward to the answers. Alright, here are the answers. Go ahead and take a look, see how many you got right. Hopefully you got all or almost all of them correct. That means you paid attention and hopefully you learned something. Alright, thanks for watching.